So I just finished Brainspotting Phase 5 with Dr. David Grant himself this weekend, and I just signed off about 12 minutes ago, and this is something I've been sitting with this whole training about what made it meaningful. So yes, we learned new skills, yes, we practiced, and yes, there were clinical nuances that expanded how we think about attachment and attunement and of course depth processing. But it's not that part that has stayed with me. It is really the warmth, because there's something I've noticed about brain spotting community that feels very relationship and attunement intact. And I also experience this with a lot of the EMDR communities that I've been fortunate to get to know. It's in general, and there were over 200 people in this training, so we didn't meet everybody, but we got to do a number of practicums that was with a new partner each time, and I couldn't help but feel the vibe, even though it was all by Zoom. Uh, it was overall like very present, curious, generous. People just weren't posturing. Maybe it's just my perceptions, but I don't think so. There wasn't this competition. There, like in any professional sphere, sometimes it might have a competitive feel to it, but that wasn't present. Just overall, no one was really trying to prove that they already know everything. Even when I was paired with somebody who is one of the veterans of brain spotting and had shared that they've been practicing it for well over a decade and were introduced to it by Dr. Grant himself. So there's the softness to that learning environment, which paradoxically kind of does allow the deeper clinical work, because you'll you see many studies that say that therapeutic alliance is the strongest factor in how treatment outcomes progress in therapy. And that same therapeutic alliance that is not between a clinician and their client, but between clinician colleagues, is equally important. And yes, and that's why it reminded me of what I've also felt for the first 2 years training in EMDR before I threw my hat over the over the wall and it jumped right into brain spotting. It's that sense that all of us are holding something very sacred and important together, and that's a kind of model of learning in a group environment, especially virtually, that matters. And the focus on the client and how the client's process is deeply personal to them was a message that was pervasive throughout the entire weekend as we learned these new techniques that are in Brain Spotting 5. So also was emphasized with was that the therapist's nervous system also matters. It's something that I've been realizing more and more over the years, which I think is not uncommon in the profession. And I think that that kind of attunement is probably the biggest variable in advanced training. So the biggest variable is the attunement, not just the protocol. And that is in the community that's formed in the 2, 3, 4 days of training, because you can learn really good techniques from really good trainers really anywhere, because since COVID, a lot of training is made available by virtual or it's hybrid. So geography no longer is the barrier that it was years ago. You can read really well crafted manuals. You can watch very impeccably done demonstrations, but the environment that you learn in, the tone, the humility, the warmth, the heart of the work, that shapes how those skills get integrated and synthesized and digested in the learning process. It it's how it lands in your body, in your emotional body as a clinician. And phase 5 was the first time I actually had a live training with Dr. David Grant. I had experienced his training style because Pessy has a number of courses where he's the trainer, and my Brain Spotting 1 and 2 were with two really, really awesome individuals, Dr. Susan Pinko and Deb Antonini, who have been training with David Grant for a really long time. So it I can see why they too were very warm in their trainings, because they learned from the developer, who brings such heart to each training is unique. So yes, phase 5 expanded my clinical understanding, knowledge of technique, and critical thinking. But it was the community that I feel was the number one factor in what makes me say I felt that it helped me expand my capacity. And honestly, that's really the most important part. So if anyone is considering advanced brain spotting training and have already done phase 1 and 2, and especially with David Grand, just know you're not just signing up for techniques, and that's a good thing. You're stepping into a field that makes relationally safe and intellectually alive happen at the same time. And that combination is really rare, and it really matters. So thank you, Dr. Grand. I had such a great time. And you'd think that 9 a.m. to 6 p.m. Pacific, 3 days in a row, and all the practicing, by now on Sunday night I'd be a little tired, but in fact I feel kind of energized. But I will make sure to get a good night's sleep, because tomorrow is the chance to start applying the skills that was taught with heart and soul in Brain Spotting 5.